These designated testing sites, why is having them important in this country?
They're imperative because one of the big worries about COVID-19 is that if we have lots of cases in a short period of time, it could overwhelm the healthcare system. And what this does is this takes a lot of pressure off the emergency departments. In the last several weeks, patients have been going to the emergency department to get tested. And, many of these people, thankfully, are not that ill, but you can see that it's volume added to their already big caseload. So these clinics will allow us to offload that, get testing done quickly in a streamlined manner, and it's really going to help. And they're popping up all over the country.
Yeah, there's one in Montreal. There's plans to open some in Ontario, elsewhere in Quebec and Alberta as well. How do they operate? How do they work?
So some of them are a little bit different than the other, but in general what happens is you have a specialized area that has the ability to isolate patients, so they're not, of course, sitting in one big waiting area that they could potentially infect each other. The staff is protected, and this is specialized for this, so the people are then tested with a swab. Also, we can have certain video capabilities in some of the clinics where they can look at the patient and go, well, maybe that patient needs to come into the hospital rather than go home. So it also has ability to test for other viruses as well, not just COVID-19. So people who are sick, we're also monitoring influenza, for example. It's another good way of getting that testing. So it's kind of like a all-in-one, one-stop shop, if you will, and it's something that's really, really helpful for the outbreak. It's going to be instrumental.
And there's discretion with the doctors in terms of who gets tested?
That is the case, but that is rapidly changing. So, for example, at the beginning of the outbreak, we would only test people, for example, that came back from certain countries like China or Iran.
Right.
But rapidly we're seeing that there's now it's any travel, and now eventually we're going to be starting to have anybody with respiratory symptoms, and certainly a number of hospitals in the Greater Toronto area that I could speak for have been doing that. So the testing is quite broad, and we're trying to capture everybody to be able to get ahead of this.
And if you get a test done in one of these remote clinics, one of the designated centers, how long does it take until you figure out the results?
It can come back very quickly. So in my experience, at least at my hospital, when we have done them, some of these tests have been coming back in 24 hours.
Wow.
Everybody is really, really on top of this. So it's just only going to be better. And I have to commend our infection control and public health practitioners across Canada, because this has been a really strong, coordinated effort.
It's interesting. In Alberta last week, the chief medical officer there said that they're going to look at retesting older influenza samples in that province for COVID-19. What do you make of that?
That's right. So the reason for doing that is one of the problems, for example, with Italy was that they discovered the outbreak when it was already in the uptick, that exponential increase, and that's why they were already in the midst of the outbreak when they discovered it. One of the things that we're trying to avoid here in Canada, learning from other places, is if you look back at some of these samples, you can get an idea, well, look, were there cases of COVID-19 before already circulating and we didn't know about it? So far, there's no evidence of that, and what we're doing is testing not only people that are presenting, but we're also going out searching for them across the country as well. And so far, there has not been any evidence of community transmission, apart from in BC, and we're looking at some cases in Ontario right now.
Should that retesting be happening all across the country?
It depends on the situation, but it's something that's being discussed among the microbiologists and infectious disease practitioners.